Namaskar. Good day, everyone. It's a privilege to stand before you and discuss a concept that has the power to reshape our future. Inclusive innovation. Let me explain. Today's our theme is about confluence, which means convergence. So I converted this theme, like there are two words, inclusion and innovation. So I converge and now it will become inclusive innovation. Before I open my talk, I would like to give emphasis on the word innovation. Innovation is a successful exploitation of new ideas into market, industry, and society. It comprises the journey from mind to marketplace, from ideas to impact. It is only through the process of innovation that knowledge can be converted into wealth and social good. Through this moment, every citizen, every constituent of India must become an innovator. The I in every Indian must stand for innovation, not for inhibition and imitation. It is better to fail in originality than succeed in imitation and inhibition. Look at the word fail, F-A-I-L, in a very positive and different manner. First attempt in learning. And that's what we have to do when it comes to inclusive innovation. So I in industry, I in every individual Indian must stand for innovation. India has rapidly moving from starting up nation to fastest growing startup nation. When we talk about innovation, or when we talk about innovation in education system, innovation spreads through across the education system as a way of life in everything we do. Like President Obama had said that education and innovation are the currencies of 21st centuries. But my mentor, the legendary Dr. MUNGEKAR, has modified his statement, and he says, considering current scenario, education in innovation and innovation in education are the real currencies of 21st century. Now, I'll begin with my talk, Innovation for All, making excellence affordable and, most important, inclusive, means for all. Okay, so innovation often brings to mind breakthroughs in technology and products, yet millions are excluded due to lack of affordability and accessibility barriers. What if we could bridge these gaps without waiting for decades of reform? Yeah. And the answer is inclusive innovation. Thus, innovation seeks to make high-quality service in healthcare, education, and essential areas accessible to everyone, irrespective of the socio-economic background. So I will be considering here healthcare and education sector predominantly. Now, this particular idea draws from the inspiration of and from the work of my mentor, Dr. MUNGEKAR, who championed the idea of Gandhian innovation, delivering more from less for more. Now, I wanted to emphasize on this statement, that though this statement suggests its own meaning. See, more from less for more. That means we need to innovate, we need to create something which is unknown to the world, but the condition is with available resources, with less cost, but we don't have to compromise with the quality and standards. That is more from less for the society, for the people, for the mass, for the class. So inclusive innovation is not just a trend, it is a necessity. Traditional business model, as you can see in the slide, thrive on premium pricing and resource abundance. Now this inclusive innovation disrupts this, proving that constraints can inspire creativity by prioritizing three very, very important things which we need: affordability, sustainability, and inclusivity. Now, when you look at in India, where vast disparities exist in healthcare and in education sector, the access, this approach is very crucial. So through this inclusive innovation, at least we can redefine success, not by exclusivity, but by elevating everyone. Now here I will take the example of this particular case study. This is my mentor, the legendary Dr. Padma Vibhushan Raghunath Mashilkar. He started his own organization, the Anjali Mashilkar Foundation, on the behest of his late mother to transform the lives of disadvantaged, excluded, and needy people of India and the world. Now, what are the challenges to solve for? Inequality, as you can see, is still one of the greatest challenges of the 21st century. While approximately 1.4 billion Indians are free, but millions are still needs basic necessities for good life. Inequalities on the grounds of income, geography, and at times religion or caste. So income inequalities lead to exclusion or access inequality, which lead to social disharmony. Now, the solution is, while it might take decades to bridge this income equality gap for all Indians, but we could achieve access equality by ensuring Indian gets access to basic necessities and are included. So this inclusive innovation is the solution of all those India's challenges. Now these are some challenges. Despite the advances in healthcare and medicine, people are still unhealthy and also succumbing to multiple diseases. As you can see, tuberculosis, 20 lakh Indians, cardiovascular diseases, 10 million Indians, maternal and child mortality, 75 preventable deaths per day. Diabetes, 101 million Indians. Cancer, 14 lakhs Indians every year. Anemia, 600 million Indians. Now, certain systemic challenges are responsible for the disease burden in India, which cannot be solved by traditional methods or conventional methods. Limited access to technology, limited access to connectivity, lack of affordability, limited infrastructure. These challenges is because of our population. So population is now it has become a global issue. Lack of quality, limited skilled human resource, and lack of awareness. Now, if you look at now, I will try to give a solution. Now, if you look at this graph, this representing expenses for diagnosis and treatment as per stage of cancer. So if you see fatty lumps, I have divided into two parts, early screening zone and late screening zone. So that side is early screening and this side is late screening. So if you look at the graph, fatty lumps, approximately 2,000 rupees. Consultation, diagnosis, medication. Fibroadenoma, the cost is around 10,000 to 50,000. Consultation, diagnosis, medication and surgery if needed. And if you see the other side, stage 1, stage 2, stage 3, stage 4 cancer, the cost is rising from 2.4 lakhs up to 20 to 25 lakhs. Now, if diagnosis is done early, the expenses for the treatment of a patient will be less than the 1/10 of the cost otherwise. So governments can save more than 50% of its healthcare treatment budget if diagnosis is done. So this is the solution. So early regular screening and diagnosis can be an important lever to solve the healthcare challenges of India at speed as well as at scale. But there are certain challenges with the current diagnosis and screening solution. It involves the treatment can be invasive or painful. It involves radiation, expensive of course, bulky equipments involved, high testing and turnaround time, requirement of trained professionals, lack of digitalization to track and monitor data at scale. Sometimes there is a scope of human error, lack of awareness, and so on. Now this is the solution. We need 4 things. Affordable. Our solution should be affordable, accessible, high quality, universal. Now affordable, low cost to be enjoyed by people across all income segments. Then the second one is accessible. Accessible in remotest part of the country with no dependence on proximity to cities. The third one is high quality. We need to maintain quality. Healthcare of excellent quality and performance using highest technology to solve the problem. But remember, we have to consider that principle also. More from less for more. And the last one is it should be universal. Products and services that are user-friendly, irrespective of individual skill levels. Now, these are the inclusive innovations or the products which are benefiting society now. I'll take two examples. Now, this is the challenge of breast cancer. Breast cancer is the most common cancer for women in India, with one woman being diagnosed with breast cancer every 4 minutes. So most cancers are detected at larger scale due to lack of cost, pain involved with mammography tests in remote areas. So this is the challenge. Now, this is the disruptive innovation solution. Eye breast exam is a painless, handheld, radiation-free, ultra-portable breast cancer screening device that allows every screening of lumps in the breast, giving instant results. It costs 90% lesser than the mammography test. So maybe in few rupees, and can be easily operable by frontline workers. So we don't need skilled professionals to do this test. This is inclusive innovation. Another example, the challenge of cardiovascular disorders. With over 30 million people suffering from heart ailments, India is the heart disease capital of the world. So heart monitoring is done mainly in routine checkups, the traditional method, and is almost non-existent in rural areas. So the conventional ECG machine is not accessible in most remote areas and not even in cities during emergencies due to its size and high cost. Now, this is the solution. Disruptive innovation, Sanket Life. It's a credit card size, you can say ECG machine. It's a credit card size, 12-lead portable ECG, which connects wirelessly and records ECG graphs on a smartphone. The ECG comes at 1/10 the cost of conventional ECG, which means if you go to hospital and if you apply for ECG test, they will give you like 2,000 rupees bill. This is only 5 rupees and very fast, and you can get the report instantly, share with the doctor, allowing regular as well as emergency heart monitoring at ultra affordable cost. So 2,000 rupees and 5 rupees. Instant. This is what we need nowadays. Inclusive innovation. I see many scientists, many people, they publish their paper in Scopus, they publish their paper in Nature, okay, but are their work is benefiting the society? So we need to think about this. Publish, perish, what you want. Now, key takeaways for adopting inclusive innovation. Now here, as an educator or researcher, I will give emphasis on the education sector after healthcare. So the first is disrupt models. So we need to think beyond the syllabus, beyond the box, innovate beyond conventional delivery methods to reach undeserved populations. So for that reason, to achieve this, as a researcher or as an educator, we need to reimagine, rethink, reinvent our education system so that we can achieve this inclusive innovation. The second is focus on affordability. So we need to develop solutions that maintain quality while being resource efficient, which means more from less for more. Gandhian innovation. The third is we need to prioritize people. Product should enhance lives rather than just boost revenue. In other terms, I can say we need to balance Lakshmi and Saraswati simultaneously. Lakshmi means wealth, Saraswati is education. So we need to balance this. Though these two girls are enemies, but we need to balance to achieve inclusive innovation. And the last one is very important, cultivate creativity. We need to educate the educators first. They have to inculcate critical thinking, logical reasoning, creativity, emotional intelligence, co-creation, all those characteristics which industry demands. Rather than teaching just the bookish knowledge, they have to inculcate this kind of things, which we call Guru Shishya, teaching in a Guru Shishya tradition. So constant drive ingenuity. So all these organizations and universities or educational systems must channel this to create impactful solutions. And finally, to achieve inclusive innovation, we all need inspiration and motivation. So for that, I have my Mashilkar mantras, which I am following, and I hope that will benefit you all also. So my guru says, your aspirations are your possibilities, so keep them as high as possible. Like instant coffee, there is no instant success. So work hard, success will follow. But remember, you have to work hard in silence. Let success make all noise. You can do anything, but not everything. So you have to choose and focus. Then there is one more very important thought which is nowadays trending. When someone tells you it cannot be done, take it more as a reflection of his or her limitation, not yours. Wow. This is trending. And there is no limit to human imagination. There is no limit to human achievement, accepting the limit you put on yourself. So go limitless, outperform yourself. If doors are closed, don't wait for the opportunities to knock on your doors. Create your own doors, build your own opportunities. And lastly, our mission is very clear. To build a future defined not by barriers, but by inclusivity and purpose. By shifting focus from exclusivity to inclusivity, we lay the foundation for a world where affordable excellence is the norm, not the exception. With this, I conclude my talk, and thank you so much for all the lovely audience for actively, patiently listening to me for this, I guess, very exhaustive talk. Thank you so much. Namaste.